Thanks for joining us. If you just in case you're not clear, this is a monthly call that we do that's usually pretty short. The intention is to create a forum by which those of you which are Epic Analysts at sites that are participating in CPRN can share best practices and get questions answered and sort of know what's coming. So I'm going to quickly just take you through upcoming packages and studies. Some of this will have impact on you. Some of it is probably just good for you to know. A little bit about data transfer training, Datavant, and then just check in on status. So in terms of what's coming before year end, we are hoping to update the ticket, the pull that Epic has with all of the CPRN forms to include it's actually 4 because there's a parent and a child version of 2 patient-reported outcome measures, which have been established by the network as core things we're going to want to do. These are things that can go into my chart. So CP Child and Goal are aimed at parents of kids that it kind of bifurcates into kids that are non-ambulatory. The parents take CP Child. Kids that are ambulatory, they take the Goal because it stands for Gait Outcome Assessment List. Orthopedics likes to use this as a pre-office visit measure and a pre-intervention measure because it does a bunch of scoring and it helps guide the discussion about a surgical intervention and whatnot. So those are well-validated outcome measures. They were implemented by Nationwide. I also gather they've been implemented at DuPont. We can come back to that, or Ben, we can talk about that separately. But there will be sort of demand from the clinical side, knowing that these are available to get these pulled and updated. And I think the primary interest will be orthopedics, but there will be some neurosurgeons and some physical medicine and some physical therapists that will be interested in having these available in my chart. People are going to want to get them out prior to clinic visits as key things for annual clinic visits and pre-surgical clinic types of visits. So that's one. Let me pause there and just see if people have questions about that.
Hey, Paul, it's Brenda. How are you?
I'm doing well. How are you?
Good. Happy Friday. So your CP Child, is that the Epic Foundation, or you guys have your own version of that, right?
So there is no Epic. So this would be the kind of thing that I do believe Epic would not put into Foundation because it's licensed. Right. So it is our own version that was done. And in fact, the workflow of it is, it can be developed at any site, but it does need to be licensed from Sick Kids in Toronto. There's no charge or anything like that. They're just trying to make sure that things stay up to date and that things are done in a proper way. And so Nationwide has a license that's going to get pushed to Epic. Anyone's going to be able to download it, but you will have to do the license individually with each site. And I will push on your clinician representatives to do that license at the point that they express interest. It's pretty simple. It's an online form they have to fill out.
Right. Well, we've done that, and we've been talking with them. I think we're stuck though in the fact that they say we can only use it for research, and I can't control who. Once you build a questionnaire, it's available for anybody.
Yeah, if you can, I can push back on that. That was originally the view, but the data is not the reporting that comes out of it is actually being used in clinical process. There are some clinicians that are using it for research. There are some clinicians that are using it as just an outcome measure for pre and post intervention. But that, if that's aimed at improving their clinical practice, it's effectively QI. And so I don't think there's any issue. I can get that clarified for you from Sick Kids if that would help. It is not required that it is not limited to research.
Okay. I'll circle back with the people who were in discussions with them and see if they've made any progress on that. Thank you.
And I've never heard from Dave, who I think you pinged on my behalf.
Yeah.
I don't think I've heard from him, but we have ongoing dialogues. We're doing a follow-up session between the
Yeah.
creator of the instrument, Uni Narayan at Sick Kids, and Gail Henderson, the Epic Analyst who implemented it sometime in 2 weeks from now. So we are very close.
Yeah. Cool. Okay. Thank you.
Yeah, no worries. Any other questions on that? Okay. The other thing I think it's valuable for you to know is we're launching a big NIH-funded study on the genetics of CP. The format of this is sites will refer people to the study. So let's say, you know, you're Dr. Wade Schrader at AI DuPont. You've got a kid who has an unknown form of cerebral palsy. You tell them about this study where, you know, you'll give them probably a piece of paper and they contact Phoenix Children's and then they receive a spit kit. They get consented and everything by Phoenix Children's. But in the end, we're going to take the data that is collected through the normal forms in the CPRN registry, and we're going to match it with people that signed up for this study. And I'm going to talk about the underlying global unique identifier that underlines that. There's no new forms that are required. We will be doing an update to the forms, and you know, we'll want those, you know, out eventually. But, and this is targeted initially at AI DuPont, Children's of Colorado, Nationwide Children's, and Seattle Children's. The reason why it's targeted at those is those centers are all up and running with registry forms at this stage, and they're all part of PedsNet. And the reason why that's important comes back to this global unique identifier. So I'll talk about that just briefly in a moment. But so that you should know, we're trying to launch this study in December. So shouldn't mean anything to you at this stage, but you're going to start to hear things talked about on this, and this is going to relate to some of the. So the key, there's a fair number of changes in this. We reviewed with a very large multidiscipline team the information we want to collect on orthoses, equipment, and past therapy. There is some data collection that happens in the forms on these today, but they hadn't sort of been validated by the CPRN team. So those are undergoing a fair number of modifications. On orthopedics, we did a very detailed review and mostly zoomed in on challenges with the spasticity measurements and sort of the measurements of all of the angles. So we're going to make a significant set of changes here for both usability, and we still are working out sort of the format. We had talked to Ben about whether or not we should do a formlet and whether or not that would benefit us. The key issue is that there are at least 2, if not 3 disciplines that spend a fair amount of time on spasticity and angle measurements, orthopedics, physical therapy, and physical medicine and rehabilitation all may spend, some of them defer it to their colleagues and others just, you know, do it and redo it. So we want to get that to be very usable and not necessarily embedded in a much larger form. We also have a couple other things that we need to change about that to just get those right. So we're going to be making significant changes there. And then there's going to be minor changes to the neurosurgery procedure, case log form, and the medical visit form, just like some places where the options need to change a little bit, so minor changes. So that's what's coming. When we have a clear picture of the date that will like make it through the NCH pipeline and be available, we'll let you know. The typical timeline has been we get it tested and done in January, and then it takes till, you know, late February or early March before it's been available for download through Epic. So I think we're on a slightly later than that timeframe. So that's what's coming.
And are those note writer?
Yeah.
Paul?
So I probably don't speak the language well enough to know this. I mean, would you say, I'll let Ben answer that as the person that's taken our stuff and done the most documentation of it. It's updates to the form, but go ahead, Ben.
What was the question?
The question is,
are those note writer smart forms that you're doing? Oh, sorry.
No, they're not note writers. So these are they're encounter level smart forms, and then they're pulled into the note via the CUI smart links.
Mm-hmm.
So that was one of the
Yeah.
challenges, I think, with just, I think when you're first undertaking this, you know, those were the questions that I have that you kind of trial and error figure out. But we ended up needing to do a bit of work on the note templates themselves to make sure it was pulling all of that in appropriately. So that's kind of my only, as Paul was talking through this, the updates, just thinking through, you know, it shouldn't require a lot of updates outside of the form, because I'm guessing we're not really changing the data elements behind the scenes. That would be the biggest thing. But that's just what was going through my head as well.
Yeah.
As long as we're not creating new data elements, and the notes should be fine.
Yeah,
Yeah.
and
We do.
there is a little bit
Go
of
ahead.
new elements being created, in particular in orthoses, equipment, and therapy. There's going to be a fair amount of change where there are new elements. There's just a few corrections. More of it is user experience for the angle measurements and specificity of rearranging the elements and how they appear on the form, and not so much changing them.
I mean, one of the biggest struggles I've had here at Scottish Rite is getting them to change from we built tons of note writer smart forms at implementation, and they're just not willing to let those go and switch over to something else. And so we're still using our old stuff. I'm almost wondering if it would be worthwhile to make these into research type smart forms and let the coordinators, I know it's double work, but pluck the measurements out of their note writer smart forms and put them in their research smart forms. I don't know. I'm just trying to think of ways that I can get the needle moving in the right direction on this stuff for us.
Yeah, I mean, it's an interesting situation because your build actually allowed us to get a lot of stuff done, and then in the 11th hour, you know, a lot of that stuff didn't go into the build, and so so like everybody else benefited from it, but you guys are kind of stuck behind it now. So I don't know. I think the resources required for that's really up to Dr. Delgado could comment as to whether or not he'd be okay with that usage. I don't know.
Yeah. I'll talk to him and Nancy.
Yeah, let me know.
Okay.
Other questions on the planned update? And we'll get to the actual details a little. You know, we're working on doing the specs and thinking through a number of UI pieces to sort of to get this right. We'll give you an update when we're down at the point where we actually know what we're implementing and have a more concrete timeline. Okay, moving along. That was it, what I had for the slides, but what I did want to explain was a little bit about DataVant, data transfer training and DataVant. So on data transfer training, we did a training with UCSD Rady and University of Virginia, may have been last week. And we recorded it. Those two sites were most interesting to us because one had done their own forms and the other had taken our forms. And so the experience on the bioinformatics on the back end is different. So since all of you are sort of on the front end of this, I just want to let you know I'm going to be sending out mail to both the data transfer distribution list. I'm going to copy you guys just so you can look at it. We've updated our specs. We have a recorded data transfer training now that we're going to encourage everyone to that is on the bioinformatics side to look at. So that has taken us quite some time to assemble. We've had the training done for 10 months, but it was taking a while to get some of the other sites to get the right people to the table. So Spencer, I don't know if you know, but like Steve was there and was very engaged with lots of questions. And so I'm hoping he's got the information he needs to sort of finalize data transfer.
Yeah, that'd be great.
Yeah, and finalize is probably not right, but make more progress. And then DataVant I've talked about, but again, this is something that probably won't affect you, but it's confusing and it's going to get talked about in and around this. It's critical to this genetics study. It's been part of the vision for CPRN. So DataVan is a company that allows people to match data sets without revealing PHI. They do it by taking a number of PHI elements and generating tokens. And there's a multi-level sort of obfuscation process. And what it does is it allows them to include in the data that gets extracted and shipped off on a per patient level to include a set of these tokens which can function as a global unique identifier. Anybody else receiving the tokens has no way to get back to the PHI, but if they have a similar set of tokens, they can say this row of data in this study matches this row of data in this study, and so you can get a richer data set. So we're educating the PIs about this. They're going to start talking about it. Those sites that are participating in the first phase of the genetic study will all have implemented that as part of being in PedsNet. So we will be talking about this more. So anyway, wanted to just give you a heads up about that, because I think you will end up hearing about it at times, and I don't want your head to spin and say, what? Any questions about that? Okay, I'd love to just get some additional status from people that are on the call. I know I've talked to many of your PIs of late, your clinicians, but the word is different from both sides. So I'll just walk down the list as I see it here. So Brenda, anything additional to report other than this challenge you were describing?
No, we're still hoping. A lot of different areas want to use the CP Child, so we've been.
I lost you, Brenda. Okay, I'm going to just keep going because I'm assuming Brenda cut out. Spencer, are you there? You're not there, which means I'm probably not here.
Questionnaires and different aspects of that.
So you cut out for me. I don't know if everybody else was able to hear you. So you said CP Child, there's interest, and then I didn't hear you after that.
Did you hear me, Ben? My update?
Yes, I did.
Okay. Ben, do you know the type of questionnaires that our organization would like to use, that they're open, of course, because it's no work on them, to give the patient the questionnaires that go over all of that extensive medical history, all those questions about, birth history and different pieces. Have you guys implemented any of those types of patient questionnaires yet for this project?
Yes, so that was kind of the crux of what we did at Nemours, because they have a system currently in place outside of Epic. It's kind of a custom homegrown called AgoraNet, where they had that workflow in place exactly. So we felt like we needed to essentially recreate that. So we created, I think I understand what you're getting at with the like Epic speak general versus history questionnaires, but we actually did it all via general questionnaires and had the data flow from that questionnaire into the CPRN forms. So all of those, like the birth history, developmental history, and all of that. There's a little bit of a, initially I didn't think it was possible, but it is possible. that you just kind of have to build the questionnaire a little bit atypical, because most of the elements are Boolean elements, in which case you kind of have to frame the questionnaire in yes/no questions, hide the yes/no as, kind of as you're trying to make it, as patient friendly as possible. So we did build that out we've had that in place for a few months now, where it's presented to the patient in my chart, and then also on the welcome tablet where they fill it out, and then that pre-populates all of the forms with that data, which is the history, but then also a lot of the like review of systems type items we are asking in that questionnaire as well.
Yeah, and I don't care necessarily. I mean, in a perfect world, I'd like for it to be a true history questionnaire template, so that, you know, any medical history question they ask would be updated, would also update the history. But I'd settle for a general history questionnaire at this point, because we've switched over to iPads, and you can't give history template questionnaires on an iPad anyway. So that's another, but I would like to import your questionnaires if that's possible. I talked to Paul about it a few meetings ago, and I think at that point he said you guys still had some tweaking to do on it. But if you have those, that might be something I can get these people to collect for CPRN.
Yeah, we do have that. I think we need to figure out the best way of doing that. We might need to talk to our respective TSs to see if they have a thought, because I know it's not, there's not a standard import specification for patient entered LQLs. I've kind of bypassed, like, you can technically create your own specification. And I know from just reading through the documentation, some organizations have done that. And that's what I ended up doing for just to make the build a little bit easier. But we should be able to get what we built and translate that over, whether it's in a turbochargers or HU move or just a straight up import specification. But I think it would be probably best to check with the TS to make sure that whatever we do is kind of has their approval or just input to make sure that we're not messing anything up or not going to break anything with the import. But yeah, otherwise we have it fully completed. I'm more than happy to to share what we did.
Awesome. Okay, cool. I'll probably reach out to my TS first, and then we'll try to link up with you guys and your TS. Thank you. That's my update. I don't know if Paul's back.
No, I'm here. I ended up dialing in with my phone, so I'm connected on both, but my internet connection is apparently being unstable. Okay, just walking down the list. Spencer, are you still there? No, I don't see Spencer. I think Spencer maybe had to go. Okay, I'll walk down this list. The 305 number, is that you, Ben?
Yes.
Oh, it's a 330 number. I'm sorry, I'm reading the digits wrong.
That's not me then.
That's not you. The 330 area code's not you. Okay. I wonder if that's Michelle, because Michelle has both a camera and a phone. Well, somebody has both a camera and a phone. Okay. Joe, how are things going at Columbia? You guys stuck?
Right now, we're trying to figure out how to implement the forms into the system. Right now, we're trying to figure out how to, well, we have the smart forms released, but right now we're really trying to get the text generation done and working.
For the notes.
Right, for the notes.
Okay. Is there anything that's sort of generic that, you know, I don't know if you've noticed, but there is I've shared a resource on the CPRN site that was developed by Ben about a number of the things that needed to be changed along those lines. I don't know if you have seen that. I'm glad to update you with access to that if you don't have it.
Yeah,
that might help.
Sure. I don't think I've seen that.
Okay, I will send that along.
Yeah, I think the main thing, if you're working on the notes, is that in the nationwide forms, there are a lot of custom smart links for like pulling in those note level items. So we ended up kind of needing to recreate those in using the standard Epic released items. And so it took some trial and error just to get that part kind of down. But what Paul has some of the like the considerations as we were going through that, and which links are custom and what have you.
Okay.
Okay, Carlos, how are things going in at Yale?
Well, Mary couldn't attend today, so I'm it. We are working on the final import by our TS of the last documents we needed, and I believe it's coming very shortly. So I'm assuming in the next week or so. So then we'll be able to have everything we need.
Okay, and then at that point you've imported, but you still have to do all of this customization of links, I presume.
Right. She's working on because some of the part of the tree is not comes along, and I know she's been working with our TS on finishing up those things.
Okay. Great, moving on down. So there's this 330 area code who I don't know who it is. I don't know if you can, looks like you're not muted. I don't know if you can speak up.
Hi, this is Michelle from Akron Children's Hospital.
Oh, hi, Michelle.
Hi.
You want to let me know how it's going there?
Well, about a year ago, we implemented the form for Dr. Baird and them to use. You guys are talking about questionnaires. We don't have any questionnaires.
Yeah,
in our
you wouldn't have them from us yet. We haven't pushed them yet. There have been some that have been developed separately. What I'm really most curious about is last time Dr. Baird said the forms were implemented, but you guys had some questions. I'm not sure if they're deployed and in use in clinic or if they're only in the playground, or what's the status?
The forms are actually in prod, so they have access to documents on the forms in prod. And we are currently now working with an analyst from Clarity that is creating those tables so that they can export the data to REDCap.
Right, is that Mike? I saw some interactions with him.
Yes, that is Mike.
Yes. That's great. So that means you guys have actually, they're not only in production, but they're being used by the clinicians for visits.
They are, but I don't know how frequently they're being used. So, but they are out there in prod for them to use. So okay. I think now that we have gotten IRB approval and we are working on getting that information so we can interface it over to REDCap, I think they are more engaged and will start using those forms.
Yeah, it would be great to know, and I would ask this of anybody that's actually got people going in at any level. Ben, I don't remember the name of the tool. There's like a quick link, I want to say it is, that you can do some very quick reporting based off of SDEs. Is that the name of the tool? Quick, are you familiar with that?
Reporting Workbench is what we have referenced for like running quick reports, but it wouldn't have any like interfacing capability per se.
I'm just curious if people, I don't know if it's easy for all of you on the Epic Analyst side to just say, and you know, we have N patients entered in using the forms or something like that. I don't know if that's something you can easily pull or not. I know they can do that easily at Nationwide, where they just use a tool to just generate a quick report. And it's not to share or anything like that. It's just to say the N is 100 or the N is 5 or something like that.
Yeah, that would be Reporting Workbench would probably be the easiest way, other than like running a Chronicle search. But for something like that, I would say Reporting Workbench is probably the easiest. Okay.
But Michelle, I don't know if that's something you would have access to and would know the answer to, but it would be great. It would be great to know sort of the set relative. I have a sense of how big your annual patient population is. Love to get a sense of how much it's getting used and what we need to do on that front.
I can look at, we do have access to Reporting Workbench, and I think you can run a report to see if a smart data element has been documented on. So I could throw some of those smart data elements in to run that report. I know they are looking at tweaking the forms a little bit just for their workflow.
Yep.
more presentation-wise, so it flows in the way that they would assess a patient or, ask questions and stuff.
Right, that's totally fine. So I would tell you that probably the single most common and valuable field is a thing called the GMFCS, and I can tell you the Epic SDE is, you probably don't want to write this down right now, but it's the equivalent of 310,57048. So Epic pound.
I think I know which smart data element you're referring to.
Yeah, that's GMFCS, and that's the one that probably hit on. Yeah, they probably hit that on 90+% of their patients. So if you could say how many people they had that data element for, that would be very useful, assuming it wasn't filled in by some other thing like a smart phrase or something else, because it would be reflective of how the form's being used.
Yes.
Okay, moving right along. Thanks, and don't hesitate to ask questions. Mike has been good in coming back with questions, and I will send him a link to the training shortly. Molly, any update from Michigan? Molly's muted and
Helps
searching
if I
for the
unmute
mute
you.
button.
Yeah.
Yeah.
I'm still waiting on Dr. Hurwitz. If I don't hear back from him, I'm at least going to put the smart forms into production the beginning of December, because we're doing a production copy down. Nobody will be using them, but right now they're just in our development environment, and I feel the need to get them into production.
I feel the need to.
What I'm waiting on him for is to go through the note templates to determine which of the smart links he needs me to custom build. And if he wasn't even sure he wanted to use the note templates. So I've reached out to him a couple of times, and I've also now engaged another provider to help me reach out to him to get this moving. So far.
Yeah, he commented on this to me not even 10 days ago, and said that you're waiting for him to review a couple things, and that he was really hoping to get to it in the next week. So I will ping him.
I appreciate any help I can get on this.
Yeah, no worries. A busy department chair that you're stuck behind. He tells me he's working on a new hospital wing at the same time. So
yeah, we are.
Yeah. So anyway, okay. And Ben, anything? I got an update when I sent out that mail about status last night from Wade. So I don't know if there's anything you want to add from your perspective.
Yeah, we just met with the group larger than just CP, but gave an update to Wade then. But yeah, they've been using the forms for a while. I think everything is going well. We're planning on retiring the custom system AgoraNet.
Yep.
And one of the keys before we are able to do that is to get the questionnaires, the patient-reported outcomes questionnaires in place. So the CP Child and Palsy. So I've finished both of those, the CP Child and the Palsy. I ended up just building them. Well, I built the CP Child from scratch. The Palsy was already in this system, but the scoring wasn't built out, or they had like very minimal scoring, and it wasn't entirely accurate because of all of the like complexities in those scoring. So I was able to complete all of that and tested it as best as I could. We're trying to go through some more testing scenarios just to make sure that it's all of the scoring logic is accurate. And I did get the forms that you had sent, I think from Cincinnati, which
Correct.
We're building essentially the same thing. It did look like they might be filing those questionnaires to flow sheets and then doing the calculation in flow sheets, because you can get a little bit more complex. It's based on just a more fundamental, like you can do some more fundamental calculations there. But with some recent, actually the most recent, well, not the most recent, but in February 2020 version of Epic, there's an extension used in MyChart scoring records that allows us to do pretty much all of the scoring that we need to do for both of those questionnaires in the MyChart scoring function. So you don't need that extra layer of build and records to support the scoring. So those were just, actually we upgrade production to February 2020 on October 10th. And after that point, I'll move those questionnaires into production, where we'll have patients start to document on those. And we're starting with, it's based on the GMFCS score as to which ones patients would fill out, I think back to what you had mentioned. And then we're only going to present those yearly to the patient. So based on GMFCS score and then yearly. So we'll start to see some of that come in after October 12th. But until then, again, just kind of awaiting to do the last bit of testing to ensure the scoring is accurate before then putting those into place for the upgrade. And then at that point, I think Wade was going to start to push really hard to get everyone using the forms within Epic so that they can retire Agornet, I think in either November or December is the timeframe they were looking at for that.
Right. I know that everyone's excited for that milestone. Great. Okay. Is there anyone that I missed that's on the call? All righty. Brenda, let me know if there's anything I can do to help you. Love to get you guys through that knothole, but it seems like a hard one.
Thanks, Paul. I appreciate it. We'll keep plugging away.
All right.
Sure.
Thanks, everybody. Sorry about my technology problems. I'll see if I can end up with something I can share in the end, but I think it's going to be rough. Anyway, talk to y'all in a month.
No worries.
Bye.
Bye-bye.
Bye.